This is Brad Eaton with Hormesis Health and Fitness. I have to believe everyone wants to be healthy, yet more than 88% of the population is metabolically unhealthy. So why could this be? Clearly, a lot of variables, but I'm going to suggest one main reason for purposes right now. It is the concept of medicalization. Sociologists use the term medicalization to describe the process by which normal or lifestyle-related conditions are redefined as medical problems requiring pharmaceutical or clinical intervention. Over time, this shifts public perception to view medications as a routine solution. When lifestyle is unrelated, there is no need to understand or apply lifestyle factors that mitigate or reverse the condition from the root cause. What follows could be the most important to your health. Metabolic health, specifically insulin resistance, is arguably the single most impactful lever for improving and preventing a broad range of chronic diseases. If we were to quantify it in terms of its influence on major non-communicable diseases, insulin resistance could be considered a root cause or a significant contributor in at least 70 to 80% of modern chronic diseases. So, how insulin resistance drives chronic disease? First is cardiovascular disease. Insulin resistance drives atherosclerosis, hypertension, and endothelial dysfunction, significantly increasing heart disease risk. The triglyceride glucose index and triglyceride to HDL ratio are strong predictors of cardiovascular degradation, both of which are worsened by insulin resistance. Number 2, hypertension. Insulin resistance promotes sodium retention, increased sympathetic nervous system activity, and arterial stiffness, all contributing to high blood pressure. Addressing metabolic health often resolves hypertension without the need for lifelong medication. Number 3, type 2 diabetes. Insulin resistance is the defining precursor to type 2 diabetes. Addressing it prevents progression to diabetes and in many cases reverses it. Number 4, obesity and fat mass dysregulation. Insulin resistance disrupts adipose tissue signaling, leading to fat accumulation, particularly visceral fat, which fuels further metabolic dysfunction. Lowering insulin resistance restores proper fat metabolism and partitioning. Number 5, neurodegenerative diseases, such as Alzheimer's or Parkinson's. Often called type 3 diabetes, Alzheimer's is closely tied to insulin resistance and glucose dysregulation in the brain. Cognitive decline is accelerated by high insulin, hyperglycemia, and vascular damage. Number 6, cancer risk. Insulin resistance promotes chronic inflammation, elevated insulin-like growth factor, and oxidative stress, increasing cancer risk, for example in breast, colon, and prostate cancers. Number 7, polycystic ovary syndrome. PCOS is primarily a disorder of insulin resistance and hyperinsulinemia, disrupting hormonal balance. Fatty liver disease, non-alcoholic fatty liver disease or NASH. Insulin resistance leads to hepatic fat accumulation, inflammation, and fibrosis, which can progress to liver failure. Number 9, autoimmune and inflammatory disorders. Chronic hyperinsulinemia increases systemic inflammation, worsening autoimmune conditions. Metabolic health as the most strategic target. Instead of treating high blood pressure, high cholesterol, obesity, and diabetes separately, focusing on insulin resistance simultaneously improves all these conditions. Strategies that improve metabolic health such as low-carb diets, strength training, fasting, circadian alignment, have the highest return on investment in disease prevention and reversal. So in conclusion, if metabolic dysfunction contributes to 70 to 80% of chronic disease burden, then targeting insulin resistance should be the primary strategic approach in modern healthcare. This is the true root cause medicine, rather than symptom management. I've been promoting and to the extent possible offering these points to clients since 2016. And honestly, it hasn't been without resistance to my efforts. I will tell you, you need to take what I have outlined to heart. There are valuable free related references on my website at hormesishealthandfitness.com. Hormesis is spelled Hormesis, hormesishealthandfitness.com. In particular, look for the free document on insulin resistance progression. If you have heard my material before, you might think this guy is all doom and gloom. Well, that's because I feel I have to shake the tree. We do not have health with 88% of the population metabolically unhealthy. It does not make sense to keep doing the same thing expecting different results. And it does not make sense to keep the same people in charge who led us to this health disaster. So, I'm going to offer a little marketing business perspective to this health problem. Peter Drucker was an Austrian-American management consultant, educator, and author, widely regarded as the father of modern management. He famously said, "If you want something new, you have to stop doing something old." The idea I am referring to is that to create new value, in this case, new health outcomes, we must dismantle the current perception of value, in this case, what health is and how we approach attaining it. Drucker's thinking suggests that before a customer embraces something new, they must first unlearn or devalue the old. This is what has to take place for people to unlock from this medical system that has had 100% of their mind share and trust, leading to the national health status we have now. Thank you.